host, Cynthia Thompson. Do I have a great show for you tonight? So sit back, put your feet up, because you're going to learn a few new things about your feet tonight. My guest today is a foot doctor here in the Charlotte area, and she is going to educate me and you, so sit back and relax, and let's get this show started. Thank you for joining me today, Dr. Jessup.
Thank you for having me.
So, Dr. Jessup, I said you were a foot doctor. What exactly does that mean?
Well, a foot doctor is a podiatrist.
Ah, okay.
So typically, podiatrists go to a 4-year undergraduate college, receive their degree, then they go to a specialty school called a podiatry school, where they go for 4 years and receive their doctor of podiatric medicine. And then they go and do a residency program that specializes in foot and ankle surgery.
So tell me, how did you decide to become a foot doctor? Of all the doctors or practices you could have done, why that?
Well, one interesting fact is I have 2 sisters that are podiatrists.
Oh, so it's in the family.
Yes, it is. Yes, it is.
So let's just start talking about our feet. Now, our feet, it has bones and tendons, and how many bones are in the foot?
We actually have 26 bones in the foot, 28 if you include the sesamoids, about 33 joints, and over 100 ligaments and tendons, muscles.
You know, our feet, they're very important. People take them for granted because they carry us. What are some common issues that you find in your office with feet?
Especially since it's the summertime, one very common condition that I find is plantar fasciitis, or you might hear people talk about heel pain, or I have a heel spur.
Thank you so much. What is the medical term for that?
Plantar fasciitis.
Okay, and what exactly is that?
So I actually have a model.
Thank you for bringing it.
This is a model of the foot. So your plantar fascia is this band right here that goes from the bottom of your heel to the ball of your foot. When you're walking and your arch flattens, it puts strain on this band. And as a result, it can get inflamed and cause pain at the heel.
So how do you treat that?
Well, one important thing is stretching. Stretching is really important. Icing, you could put a water bottle in the freezer, roll your foot on it. We also have devices called a night splint that actually keeps your foot at a right angle to stretch your plantar fascia. If you have a lot of pain, you may hear people talk about receiving injections in their heel. And that's just for pain and inflammation.
What's another type of illness people come to your office with about their feet?
Another common one, along with plantar fasciitis, is Achilles tendonitis.
And what is that?
So you hear people talk about their calf or their heel cord. That's your Achilles tendon. So that also gets inflamed, and it pulls on the back of the heel and causes pain. So as far as treatment, it's very similar. Same stretching exercises. You can ice the area, night splint. If it's really bad, you can actually put a boot on. For both of those conditions, it's very important, for one, do not walk barefoot, which is very hard for a lot of people, especially when you're going on trips, because a lot of people are going to the beach, which of course you're walking barefoot, or you're wearing flip-flops that have absolutely no support.
Right.
So it's very important to wear supportive shoes, typically athletic shoes, or inserts. So you can either have prefabricated inserts, which are typically over the counter. The ones that you typically get at the grocery store, they are mainly for cushion. They're like gel. So it makes your foot feel great, but it's not supportive. So later on throughout the day, your foot will start to hurt. You need something that's firm and supportive to help support the arch of your foot, to basically make sure that this band right here does not get strained and cause you pain.
You know, do you have patients coming into your office for things like ingrown toenails?
Yes.
So you take care of the toenail also?
Yes, I do.
Oh, so what really causes that? I've never understood that. I've never had one before, thank God. So what causes that?
Actually, typically your nail should grow straight out. However, with the ingrown toenail, it actually is curved and it grows into the skin, which can cause pain, redness, swelling, drainage, and even pus. So as far as a treatment for it, typically in the office, we do a minor office procedure where we just take out that side of the nail, not the entire nail, but just the side of the nail, which either you can allow it to grow back or we can put a chemical in to basically kill the root of the nail to prevent it from growing back, just that side of the nail. To prevent you from having an ingrown nail in the future.
So it just happens? Is it caused by poor fitting shoes, socks? How does that even happen?
Sometimes it can happen from tight shoes. A lot of times people getting pedicures. The way that they cut your nail can cause you to have an ingrown. And some people just throughout their parents have it, and it's just hereditary.
You know, Dr. Jessup, let's take a short break. When we come back, we're going to talk about some more illnesses or issues that people have with their feet. Okay?
Okay.
All right.
Morning, sunshine. Wakey, wakey. You up? What'd you dream about? Me? JK.
Text me back.
I'll keep texting till you wake up. Are your parents home later? Is this something I did? Exclamation point, question mark? This isn't a joke. Hello? Text me.
So, I just moved in with this family, and it's embarrassing. The little one, he likes to go outside and crawl around in the giant litter box. I don't know what he's doing. I mean, I was born, and I knew how to use the litter box. Look at that. That's disgusting. Oh, poop already. You're making me nervous. Oh, okay, I can't look at this anymore. I really hope he grows out of this, for his sake.
Hey, I'm Anderson Cooper. As a parent, you want to make sure that your child knows how to deal with bullying when they see it happening. And chances are they want to help, but they don't really know how. Well, teach them that the best thing to do is calmly walk away, find a teacher or other adult, and speak up. And do your part. Be that adult they can talk to and trust will listen. Join me to help stop bullying. Go to stopbullying.gov to find out more.
Welcome back to Betty. I'm your host, Cynthia Thompson, here with Dr. Jessup. Now, she has taught me so much about my feet that I had no idea all these things happen and why. I've often heard of my friends talking about issues with their feet, but thank goodness I have never had any. So tell me, when we're talking about the ingrown nail, is it okay, and I've seen some people do this, take their toenails off? I know two people that have done this.
The entire toenail?
Yes. There's nothing there.
Well, it depends. Typically, if you just have an ingrown nail, you can just take the sides off. Some people, they have an extremely thick nail, and then they choose to have the entire nail taken off. So it can grow thick, and it can start growing deformed where it's curved, and they have the entire nail taken off.
So is it safe for them to do that?
Well, it is, but typically the nail is basically a protective layer because right underneath the skin is your bone. But it can be done.
So, you know, there's another issue that I have a friend that has this issue, athlete's feet. And I did not think that women could get this. I just thought it was just men that had it. So how does that happen?
Well, athlete's foot is typically a fungal skin infection.
Oh.
So fungus typically loves warm, moist environments. So a lot of times in your shoes is a warm, moist environment, especially if your feet sweat. Perspiration causes a great environment for fungus to actually flourish. Typically people have scaling, some redness, itching. You can even have small little blisters. Ooh. And in between the toes, you can have little white areas, which we call macerations, which are signs of athlete's foot. A lot of times people can get it from pools. They can also get it from locker rooms or community showers, where it typically got its name, athlete's foot.
You can get it from the swimming pool too?
Yes, ma'am.
Oh my God, I did not know that. Wow. So we mentioned shoes, like tight shoes, tennis shoes. You know, we ladies love our high heels.
Yes, we do.
So can you give us some pointers on how to take care of our feet and still look cute too?
Well, the things we do for beauty. You can wear your heels, but I always tell people wear your heels in moderation. So if you're going to wear them for a short period of time, for example, you're going to a restaurant, you have on a nice dress, or you're only walking for a short distance, then your heels are fine. The problem comes in is when people wear them every single day.
And I have seen this.
Yes, and as a result of that, you can have several different conditions. One of them can be Achilles tendonitis, because it causes your Achilles tendon to be extremely tight from you being in a high heel. Another condition is metatarsalgia, which is pain.
What was that word?
Pain along the ball of the foot.
Okay.
Along the entire ball of the foot, because you have little fat pads that are underneath your bones. Well, as you put excess pressure over time, those fat pads degenerate, and it's almost in a sense as if you're just walking right on that bone, and it can cause you pain. Another condition is a neuroma. And a neuroma is basically a nerve entrapment, an inflamed nerve. So on your foot, you have your metatarsal heads, which are right here. You have a nerve that goes in between the metatarsal head. And whenever you're wearing shoes that squeeze your foot together, that will cause the nerve to get trapped, it'll get inflamed, and it'll start causing numbness to those toes, burning sensations, or people will say it feels like they're walking on a marble on the bottom of their foot.
Ooh.
So as a result, a lot of times for treatment, one, stop wearing the tight shoes. Wear a shoe that has a wide toe box. So the toe box area is around this area of your foot. Make sure it's wide enough where it's not squeezing those bones together, which is going to aggravate the nerve.
And what's another condition that women have with these high heel shoes?
Other conditions are, one, bunions and hammer toes.
Hammer toes? What is that?
You may see some women where they have their toe, and your toe is made up of 3 bones. You have your proximal phalanx, your middle phalanx, and your distal phalanx. So it starts to contract in an upside down V. And you'll hear a lot of people say, well, my toe is contracting and it's rubbing up against my shoe. And some people talk about how they have corns on top of their on top of their toes, and that's just from the friction in their shoes. And that's typically caused by a muscular imbalance.
And so how do you repair that, or can you fix that?
Well, options are either wider shoes once again, or shoes with a deeper toe box, which typically are not your pretty heels. There's toe splints. There's silicone pads to basically pad that area in your shoe so you do not have pain. And then you can have surgery to straighten.
Surgery?
Yes, to straighten the toe.
Now, you mentioned bunions. I've seen this a lot where I work. And I just kind of shake my head because I don't have any, knock on wood. So how does that even happen?
So with bunions, typically, once again, that is a muscle imbalance also, where the big toe starts to move over towards the second toe. And as a result, it makes your first metatarsal head extremely prominent, which is that bump that you see on the side. And people will often say, I can't wear my dress shoes because of the bump of irritation. So as far as treatment, once again, padding. You can use splints. Now, typically the splints are not going to correct the deformity. It may help prevent it from getting worse. But basically, it's just to help prevent it from your toe moving over to the second toe. Because eventually you'll move it over to the second toe, and it'll move the second toe out the way. And then you'll have a hammer toe of the second.
You'll have jacked up feet.
Yes. So padding, you can get an injection in the joint. And also surgery.
Surgery again. Now, we've been talking about the ladies. What about the men? Do they have these same issues, or do they have different ones?
Men, they have similar issues. I would say for men, one of them we already discussed, which is athlete's foot. However, the treatment for athlete's foot is to make sure that your feet are dry. So especially with men, they typically seem to perspire a lot more than women. So there's over-the-counter foot powders you can put in your shoes, or there's actually antiperspirants for your feet that are at the drugstore. Yes. If you sweat a lot, typically I tell a lot of my male patients to change your socks several times throughout the day just to prevent.
Oh.
Yep.
You know, let's take a short break. When we come back, we're going to talk some more about our feet. Okay? Wow, that is good.
So, same time next week?
Well, of course. Put away a few bucks, feel like $1 million. For free tips to help you save, go to Feed the Pig.
Jangan awal.
This song was created with heartbeats of children in need. Find out how it can help frontline health workers bring hope to millions of children at everybeatmatters.org.
2 outs with a runner on first base. Now the big guy comes up to bat, hitting .342 with 92 RBIs and 36 homers.
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Welcome back to Better You. I'm your host, Cynthia Thompson. I'm here with Dr. Jessup, and she's really sharing a lot about how to take care of our feet, some of our issues with our feet, and we talked about men just a little bit, but on our break you said there's another issue that men normally have, that women do. Do women have this issue too?
Women do, but I see a lot more men.
And that
women.
was what again?
Gout.
Gout. What is gout?
You will hear people talk about they have the gout. So gout is basically a buildup of uric acid in your system. So typically uric acid breaks down purines, which is naturally occurring in your body. However, purines are also in high protein foods. So if you get a high level of uric acid, it will go through your bloodstream and it'll actually start to crystallize, and it can crystallize in your joint. So the most common joint in the foot is your big toe joint. So it'll present as a red, hot, swollen, extremely painful joint where it hurts to even put a bed sheet over your toe. So typically when men come in, you have to determine whether it's gout or if it's an actual infection. So you have labs performed and you test for the uric acid. And typically the uric acid is high. That's when you can take medication to lower your uric acid levels. But that's very common with men. And as far as prevention, is typically hydration. Dehydration can cause you to have a gout attack. Decrease your alcohol intake. But also meat and seafood are high in purines. So,
and you find it more so in men than women?
Yes.
Wow, that is really interesting. Huh. I never heard any woman say they had the gout. So do they always say the gout?
Yes, they do for some reason. Yes, they do. But yes, I have a ton of men that come in with that condition. So typically medications, you can get an injection in the joint, but really just changing your diet and hydration.
So that's really the only main issue that men have besides the athlete's foot?
I would say athlete's foot, gout. Men also have plantar fasciitis, Achilles tendonitis. Your athletes, especially a lot of people, since it's the summertime, a lot of marathon runners, they will have stress fractures. However, stress fractures are more common in women than men. And basically, stress fractures happen when you have repetitive stress. For example, marathon runners are running 12 miles or more. So when your muscles typically absorb a lot of the shock, but when your muscles start to fatigue, that stress goes on the bone. And it can weaken the bone and cause like a hairline. You hear people talk about a hairline fracture, which is a stress fracture.
You know, I'm so glad you brought that up about runners. It is the summer months, and some people run into the fall, not so much in the winter. How often should a runner change their shoes?
Now, typically it depends on how much you run. People that run marathons, they should probably change their shoes. Some people 3 months, every 3 months. If you're doing a lot of walking, I typically tell people you should definitely change them every year. You shouldn't go past a year because that's when people start to have problems. But most importantly, if you're running, one of the causes of a lot of conditions or problems with your feet is just not stretching. So it's very important to do a warm-up, stretch your feet before exercise, and then also stretch afterwards.
So do you have a lot of patients that have diabetes that come into your office?
Yes, I do.
And why do they need to come and visit you so often?
Well, diabetics typically come in just for what I call a preventative foot exam. Because with diabetes, you might hear people talk about neuropathy, which is a disease of the nerve. So you'll hear diabetics talk about their blood sugar, which is their glucose levels. When it's higher than normal, it can affect the nerves, which can cause numbness and tingling sensations in the foot, which we call neuropathy, which is a disease of the nerves. Now, it can cause the numbness and tingling, but it can also cause painful neuropathy, which are the shooting, stabbing pains. Your feet feel as if they're on fire. And there are various medications for the painful part of neuropathy. But because you have numbness in your foot, you can actually step on something and not realize it. So let's say that I step on a piece of glass and I don't realize I stepped on a piece of glass because my feet are numb, I can't feel anything. I don't treat that area, and then you wind up getting an infection of the foot. So it's very important for diabetics to check their feet every day. I tell some people if you can't reach your feet, you can't pull them up to look at the bottom of your feet, you can always get a hand mirror to look at the bottom of your feet and to never walk barefoot, just for that simple fact that you could step on something, not realize it, get an infection, the infection can go to the bone, and then that's when you see a lot of diabetics getting amputations of their toes, half of their foot, or even below or above the knee amputations.
Oh my God.
And I also tell diabetics too to make sure that they wear white socks. So if something happens to be in your shoe and you don't realize it, you could take your socks off and you'll see blood or drainage on your sock, which will make you look at your foot to see what's going on.
So we've talked a lot about our feet, and I'm sure you have some stories that you could tell. What is one of your strangest or most unusual cases that's coming to your office?
Let's see, the most unusual cases. Well, I know I had actually a case when I was in residency. I had a patient. I can just remember this as opposed to the office. I had a patient that came in. Foot was red, hot, swollen, and it was actually moving up the leg at a rapid rate. And the patient wound up having a condition called necrotizing fasciitis, which you've probably heard in the news, flesh-eating bacteria, where you have to immediately take them to the OR, the operating room, and basically do an incision, drainage, and debridement.
Oh my God.
But it was just interesting because she said from that morning, over the course of 2 hours, it went from just her foot, like around her toes, and it moved up her leg.
Oh my God. Wow, Dr. Jessup. Thank you so much for joining me. I've learned so much today about our feet, something that we all take for granted. But like you said, we need to take care of our feet because they take care of us, right?
Correct.
And if by chance someone wanted to contact you with more questions, do you have a website?
Yes, I have www.jessupfootandankle.com.
Okay, you might be getting some emails. And thank you so much for joining me, too.
Thank you for having me.
And I want to thank each and every one of you for watching my show, A Better You, here on Public Access 21, every Wednesday night at 6 p.m. Thank you so much.
Thank you.
Always been such a huge love.